Welcome to the Foot Health Facts Podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. We're back with Dr. Tyler Tewilliager, foot and ankle surgeon in Houma, Louisiana, soon to be married man. Last episode, we talked about what really happens when you sprain an ankle and how to know if it's more than just a simple twist. Today, we're tackling the big follow-up question, why does it keep happening? So, Tyler, once you've sprained an ankle, how likely are you to do it again?
Yeah, if you look at the stats, it's about 50% of all ankles that if you injure it, there's a good chance you injure it again. It's not, you have a simple little sprain like we talked about in episode one. Those ones probably a little bit less likely. You have one of those severe sprains and you don't treat it appropriately, you are setting yourself up for recurrent ankle sprains throughout the course of your life. The number of patients that have come in who have had 6, 7, 8 horrible sprains by the time they finally get in to be treated, at that point, we're a little bit more limited on our options. So, really catching them early, treating it appropriately early is the best way to prevent recurrent sprains from happening.
Yeah, I think it also depends on the patient's foot structure too. So they might have,
Yep.
a previous injury, but if they have one of those like high arched feet, they tend to are prone to kind of rolling that ankle a little bit more easily, correct?
100%, 100%.
Yeah.
It sets you up for failure big time.
So what does it actually mean when we say someone has chronic ankle instability?
Yeah, the way I kind of think about it is, I tell my patients this all the time, kind of think of your ligaments like a rubber band. The more you stretch them, the weaker that rubber band's going to get in that spot where the ligaments hold everything together. If it stretches out too far, you lose that elasticity, which really doesn't allow your body to protect your ankle if you're on uneven ground. You hit a pebble the wrong way, your ligament stretches out. Instead of holding it in place, it's already a little too stretched out, and then you keep rolling it, keep re-injuring it. And that's the cycle that kind of unfortunately sets you up for chronic instability. These repeat injuries over time because your ligament doesn't heal in the appropriate position.
So how do you rebuild strength and confidence in an ankle that just doesn't feel trustworthy anymore?
Yeah, so that's a hard thing to do. For me, I lean heavily on our physical therapy group. I really have a very aggressive physical therapy team that pushes people early when it's safe to do so, and really work on that stabilization of the ankle, training the muscles around the ankle to help protect it as well. And unfortunately, if you can't train your body to protect itself, sometimes it's a long-term brace versus surgery to repair those ligaments.
So into bracing, what's your take on bracing? Useful tool, training wheels, or just a long-term crutch?
Yeah, I'm a big fan of bracing. I use a lace-up ankle brace pretty much on any ankle sprain that comes in if it's not in dire need of a boot because of inability to walk. I kind of let my physical therapist wean them out of that because I don't want somebody in it forever unless they have to be. If you're at the point where physical therapy isn't working for you, you can't get your ankle strong enough, and you don't want surgery. Sometimes a long-term brace is the best way to not break your ankle from rolling it.
So what's your best advice for someone who's had a few sprains and wants to stay active without constantly worrying about another one?
Yeah, that's one where you should get in to see your local foot and ankle provider for sure, because they can evaluate you. Sometimes you need to get an MRI to evaluate how bad the tears are, how bad the instability is. But a lot of times for me, that's physical therapy and really being aggressive with it to try and stay active.
So always we try to avoid surgery. In the next episode, we're going to talk about what happens when you can't avoid surgery. So you've been listening to the Foot Health Facts podcast. For more information on today's topic or any foot and ankle concern, head over to foothealthfacts.org. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. If you enjoyed this episode, don't forget to like, subscribe, and share it with someone you care about. Together, we'll keep everyone moving forward, one step and one topic at a time.